Hey everyone, in this video I'm going to talk about exam related topics of thorax part of anatomy. There is a lot to cover in this chapter, but some topics which easily lets us score needs a mention. You are free to take screenshots of the slides and ignore my talk, but I suggest you to hear me out if time permits, as I am going to add extra little advice and tips to every topic as to how their answers must be written to get good marks. So without wasting time, let's start. So the first topic which might come in short notes is mediastinum. The boundaries contents of superior, anterior, middle and inferior mediastinum along with the diagram needs to be written. Then is the conducting system of heart. The SA nodes, AV node, bundle of His, right and left branch of the bundle of His and the Purkinje fibers along with the gross representation or diagram are needs to be written. Then is the intercostal space, the content, arrangement, and position of the artery, vein, or nerve, and the clinical aspect as to where the aspiration of the pleura is done. Then is thoracic duct. The features, course, relation, and tributaries, and the diagram are important. Then is the arch of aorta. The course, relation, branches, and diagram of arch of aorta is important. In the roots of lung, the main catch point is that the right and left lung have different type of roots with respect to content, the arrangement of the contents, along with the diagram of both roots. In the viva and theory, the examiners ask the differences between the right and left lung along with the roots. Then is the recesses of pleura. The diagram, the rib level, and the dimensions in centimeter are to be written. Then is the right atrium, the external features, tributaries, inlets of the right atrium, internal features including the anterior surface and posterior surface, which one is the rough one and which one is the smooth one, are to be written and a perfect diagram needs to be drawn. And the interarterial septum and the diagram of the interarterial septum needs to be drawn too. Then again, as I said, the differences between the right and left lung is important. So mention about the roots also. Then is constriction sites of the esophagus. What are the vertebral levels and the diagram needs to be written. So the diaphragm has certain openings and those openings are present in certain vertebral levels. So that is important for viva as well as for theory. In the histology of lung, the diagram is important, the feature is important, and the interior of right atrium can be asked separately as a short note, like the internal features including the anterior and posterior surfaces, which is the rough one and which is the smooth one, including the interarterial septum and the diagram. So moving to the topics important with respect to the long notes are heart, lungs, aorta and mediastinum. As I've mentioned in the slide of video, in the heart, grooves, chambers, conducting system, blood supply, and the orifices of heart, along with each and every diagram for all the subtopics, are important. And these are literally asked in the university exam. Then is the lungs. From the lungs point of view, the diagram, the pleural surfaces, the roots of lung, the fissures, and the lobes and the bronchopulmonary segments, along with all the diagrams respectively, are important. So, with respect to aorta, the ascending, the arch of aorta, and the descending branch, along with the course, branches, the relations are important, along with the diagram. In the mediastinum part, it's just like short notes, but you try to write in a more elaborated way. It should like look like long notes. So this was it from thorax. Thankfully it wasn't much a long video, so I'll be uploading important topics from other chapters too. Check them out in my channel's playlist, and thank you.